On today's World Insight, amid an apparent COVID-19 ebb in China, the WHO cautioned containment must go on. A one-on-one with the WHO rep who led a joint team to China.
Complacency is always the biggest risk when it comes to dealing with a virus.
And woes over COVID-19 testing and outbreak response in the U.S. A former U.S. CDC chief and another public health expert shed some light. Here is our host, CHEN.
Hello and welcome to World Insight, coming to you live on CGTN from Beijing. I'm Tian Wei. We begin today's program with the apparently waning COVID-19 epidemic in China. The number of new cases have fallen significantly, with 120 on Tuesday. Almost all of them were in Hubei province, where the outbreak began. Meanwhile, the WHO chief said on Monday that focus was shifting to countries outside China, where the virus was now spreading much faster. More than 12,000 cases have been reported outside China in 76 countries and regions now. South Korea is still the worst hit, followed by Italy and Iran. In late February, a WHO team joined the Chinese scientists in touring 5 Chinese cities to study the epidemic and to determine how effective the response was. They later released a report about the result. Does China's experience apply in other countries or be of any help to the others? Earlier, I talked to Dr. Bruce Aylward, the WHO Assistant Director General, who led the joint mission. He told me now it is the time for China to not relax, and for the world, hard lessons from China's experience are helpful. For more, joining us in Geneva, Bruce Aylward, the WHO epidemiologist who also led the WHO China joint mission on COVID-19. Dr. Aylward, welcome to CGTN.
Thank you very much, Wei.
You were not sleeping at all during your days in China. I hope you catch up a little bit with the sleep while you're back in Geneva.
No, since we got back from China, we had to get the report finalized, and then we had to share the findings. And there's been a tremendous interest in what happened in China, so we haven't got much more sleep even since we've gotten back. Also because, of course, there's been the developments in the other parts of the world where the disease has escalated since our return.
Talking about China's case, the day you left to now, there seems to be quite a huge difference. Today, only 4 new confirmed cases outside Hubei. Dr. Aylward, what's your assessment of the latest?
I think this is what we expected to see based on the epidemiology that we saw in China, the control measures that were being applied, or containment measures, and then the impact of those measures. I also expected that at a certain point there was going to be a rapid decline in cases, and that's exactly what we've seen in China. And this is so important to the rest of the world because it's further affirmation that even when the situation gets what looks like it's quite out of control at some points in other places, you actually can contain this virus. So everything we've seen since leaving China is consistent with what we saw in the country and what one would expect. But it's very, very impressive, and it still is the standard for the rest of the world.
What do you consider still as the biggest danger facing China? Now, a lot of people have been talking about the danger of imported cases, meaning others traveling from abroad into China, and as a result, the spread of the virus. But Dr. Aylward, without stigmatization, of course, what is the biggest danger you think that is facing China today?
The single biggest danger is complacency, and this was something we talked about in China a fair bit, that people drop their guard against this disease. This is still the same virus that caused the situation we see and still dealing with in Wuhan. It is still a very serious situation and a very concerning virus that can wreak havoc. And the moment we drop our guard, a virus like this is going to take advantage. It's going to start to spread again. And one of the things that most impressed me in China was, as I spoke to governors and mayors in different provinces, even though cases were coming down, they were still building beds, buying respirators, because they said, look, if this happens again or cases start to increase as children go back to school, as factories reopen, we have to be prepared for it. And I think the really striking thing in China is, as you've had importations, you found them quickly, found their contacts, got them isolated, and demonstrated again to the world that this is manageable, whether the disease arises from within the country or you get importations. But complacency is always the biggest risk when it comes to dealing with a virus, any disease, when it's in decline.
Complacency, complacency, complacency. You offered that advice days ago when you were in China. Now, how would you compare what's going on in the rest of the world? Now we know the number of confirmed cases have been rising very fast, and as you said earlier, things are happening fast in this epidemic. So anything they could do?
Yeah, absolutely, Wei. I think what we're seeing in the rest of the world are two, possibly three patterns, and it's not unlike what we saw within different areas of China. What we're seeing is sporadic importations in places, take Canada for example. They've had a number of cases, they're getting found quickly, they're quickly acting on them, following exactly the same public health principles you employ in China. And then we have a separate situation where we're getting undetected spread early on, and then that exponential growth which takes off and gets you in trouble. This virus moves very fast. It's that exponential growth that you're trying to prevent. And what we're seeing in Italy, what we're seeing in Korea is exactly that situation. But that's not the situation everywhere. A lot of countries have really taken to heart what they've learned from China and what we've been talking about. They're rapidly finding these cases, rapidly containing them, using the principles that China employed. They're not learning from scratch.
At the point when you were in China, do you find much evidence at all there were underreporting? Because the numbers are extremely important in terms of what measures to take in order to fight against the virus.
Sure. Well, that's a really important point, Wei, because in the world I work in, there's two things are important, but the most important usually is the trend. Are cases going down? Are cases going up? Right. What does that angle of increase or decrease look like? Because that's really what tells you what's happening to this virus. And the first thing I would say in China is that we have absolute confidence, and this is not me speculating, this is a group of international and national experts, independent of what happened in China, looking at different pieces of information and coming to the very, very robust conclusion that the decreasing trend is absolutely real, no question. Are you finding every case? No. We never find every case in a situation like this. But what you're looking for, again, the second thing you're looking for is not necessarily every single case. That has to be your goal, every case, every contact. But the key thing you're looking for is every chain of transmission. And the chains of transmission, they make themselves known very quickly because they explode with this disease. And the evidence from China suggests that you're finding the vast majority of chains of transmission, and you're finding them fast. There's a number of indicators that support that. So those are the two key things. What's happening with respect to the trend, and then what's happening in terms of the chains of transmission. Both counts, and again, it wasn't easy for China. You know, one of the things I learned a lot, and people were very, very honest. They said, look, we had to learn this, and we had to learn it fast. And we, you know, there were shortcomings, there were obstacles. Yeah, that honesty about some of the problems really helped me yesterday when I was talking to people running the Iranian response, people running the Italian response. You know, I was able to bring it alive in terms of what China was doing, and that really, really helped them.
I see. According to the latest report, research suggested that the virus has been mutating quite much. In fact, according to latest research, 194 latest mutations, and the virus is going very differently in different parts of the world. Dr. AYLWARD, you've been an epidemiologist for decades, and you witnessed some of the biggest outbreaks of some of the most important viruses we've seen over the years. What do you make of the latest development?
Yeah, so first of all, I'm an epidemiologist, like you said, not a virologist, but by the same token, there are some really important features. What sounds like a lot of change in a virus sometimes is not as meaningful in terms of your ability to respond and manage it. And what I mean by that is the coronaviruses are actually fairly stable viruses. All viruses change, mutate, and evolve, as your viewers will know. Some of them are notorious, such as the flu virus, which is part of what makes it so difficult to manage. HIV virus also can mutate in ways that can make it difficult for control measures to affect it and certain targets. But with this virus, even though there's changes, it's behaving the same way. The basic characteristics about how it transmits, the case fatality, how it causes disease, those are remaining quite stable. And this is really important because there's a danger that people could start to think, oh, it was bad in China, but now it's mutated and it's not as bad. It only causes a cold. That is not the case. So I think it's a really important thing to bear in mind. I'm glad you raised that.
Dr. AYLWARD, when I was listening to you just now, I was thinking, there's still a lot of people wondering, whether this COVID-19 is as serious as a flu. You know, let's just debate where the source was for the COVID-19 before we jump on to save our lives. And there are also others debating, whether we should have some of the contingency plans, as you said, complacency, whether we should have that going because we also have another priority. So listening to your advice earlier really reminds me a lot of these talks going on. What do you make of them, Doc?
Yep. So there's three questions in what you just asked, Wei, but the most important is the comparison to flu, and that has to stop because one of the things that we really noticed as we got to understand the virus in China, because we had so many numbers and such power of information. This is not flu. It's not SARS, but it's not flu. It's a new coronavirus, and we have to respect that. The thinking is, and so far all the evidence, that you cannot stop a flu virus the way you've been able to stop COVID, because it's a different virus, transmits, some of the features about how it transmits among populations are different, which gives you room to attack it with the public health measures, the case finding, contact tracing that you did. So it's different than flu in that regard. The other thing is, this is not a bad flu. This is a virus that kills up to 2% of the population, and it kills a lot of your elderly. This is a serious or very concerning virus, and I think those comparisons to flu, because flu people know is seasonal flu, and the mortality rate is much, much lower than what we're seeing, sometimes an order of magnitude lower than what we're seeing with this disease. And when was the last time we saw flu cause the societal and economic devastation that COVID does? So I want to hammer that point a little bit because I dealt with it even here in a question and answer situation in WHO.
Yeah.
So important we're clear on that.
Yeah.
We also have to figure out where this virus came from, because if we don't know that, it can come back again. So we've got to figure that out just like we did for SARS, and I'm sure we can. There's some good things in China already happening to look at that. But the big point you made, and the last one around complacency, in China, I say that's the big risk, but I've never seen a country work so hard to not be complacent. In China, I found such a pragmatism. People are saying, look, this disease may not disappear again like SARS did. We may just have this in our population, and what we've got to do is learn how to run our economy and everything with it. And they're preparing for that, contingencies for that. And so far, we're seeing it work. Again, we're still early in this disease, but China's leading the way.
On the other hand, we still have not seen successful yet therapeutic treatment or drugs specifically targeting at this coronavirus, COVID-19. Meanwhile, we also do not see yet on the immediate horizon about vaccines. So many people wonder what's going to happen with COVID-19 as more cases reporting around the world, as the cases coming down to China. What's going to happen? What's likely to be the trend? Dr. AYLWARD.
Yeah, super important question, Wei. And this is where this disease, it's another way that COVID-19 is different than flu. With flu and pandemic flu, we've been making vaccines for years. We know how to make flu vaccines. It's simply a matter of time to get your flu vaccines developed, designed, and then in use in flu epidemics or pandemics. COVID-19 is different. We do not have a good track record with vaccines against these viruses, nor do we have a good track record with therapeutics. And that makes the approach from China so much more important, and that's part of the message I'm giving to the world is you have got to contain this virus with traditional public health measures, because we're not going to have a vaccine in the next 6 months and possibly much longer. We are not going to have necessarily a therapeutic in the very near term, because even if we do get a therapeutic that works, we're going to have production issues, etc.
Right.
The key thing right now is prevent the disease, and when you have it, contain it and stop the transmission chains.
So you are saying let's have tailored approach, just as some of the cases here in China, and try to do things fast with that so-called whole nation approach, but very tailored in when we try to do it in different parts of the world. Is that what you're trying to say, sir?
Well, that's another point, but it was a really big learning from China, and I have to say how grateful I am for the patience of the Chinese colleagues who explained this to me, because there's many people think China took a one-size-fits-all approach and just said, everybody, we stop the schools, we stop the roads, everybody stays at home, etc. And it wasn't. It was a much more tailored approach. I heard that again and again and again in China. Do you have 0 cases in your area? Do you have sporadic cases? Do you have clusters or community transmission? And what are your capacities? And you tailor your approach to that. A really important message. But more important is the tailored approach works. It's not a compromise, it's a tailoring. And that's a big message we're giving to the world.
Absolutely. Dr. AYLWARD, I understand that you were in Wuhan. So what was it like for you and your team to be there? Who have you talked to? With what kind of conditions were you talking to them? What kind of info were you trying to get? Did you get all the info that you desired? And how do you see the doctors and the medical workers there be able to protect themselves? How were they interacting with the official side and also the patients? How does that work, Dr. AYLWARD?
When I pulled into to Wuhan, and by the time I left, about 36 hours later, it was at one level heartbreaking as I listened to the stories of individuals, and the Chinese just wonderful people, the people of Wuhan, how they speak to you and tell you what they really think. So it was heartbreaking to understand the loss of life, the devastation, the impact so much beyond the disease itself, and how deeply scarred the population would be. But much bigger feeling that I left with was how inspired I was. I left with such a deep admiration for the people of Wuhan and for Chinese society in general, because what I saw was a tremendous sense of responsibility and of duty to protect their families, their communities, and even the world from this disease. It was truly inspiring. No matter who I spoke to, whether it was a translator, whether it was someone in a train station, when we pulled in, it was always the same message. This is our duty. This is what we need to do. And that's a very hard thing to do a month into this. So, those were the big feelings. Now, while we were there, we tried to see every aspect of the response. We talked to the political leadership. We talked talked to even Minister Ma, who was managing, the key piece of the response there. We spoke to people who were in the trenches doing the contact tracing, trying to help find the contacts. We talked to people in the stadiums who were taking care of the mild cases. We talked to doctors who were taking care of the severe cases. We talked to nurses running the fever clinics. We talked to so many different folks to try and get a feel for what was happening there. And what we saw, again, it was inspiring and helped us admire how the systems that have been developed. And another word that I heard a lot in China was the need for an orderly approach. And I'm sure at some point things were chaotic. They have to be when you have rapidly, exponentially increasing disease. But the order that had been brought to so many different aspects of the response, whether refitting stadiums, refitting hospitals, etc., was impressive indeed.
Dr. Bruce AYLWARD, the WHO epidemiologist who also led the WHO China Joint Mission on COVID-19. Thank you so much, sir. Really appreciate it. Do get a little sleep if you can.
Thank you, Wei, and thank you for what you do. Journalists and people with a platform like yours are so important to this disease. It's what the population knows, what they understand, and understanding it accurately, because the population is what's going to stop COVID. Not the doctors, not the nurses. We deal with consequences. It's your population and people like you who are telling them what to do that are so important. So thank you for everything you do as well.
Thank you, Bruce. Hope to talk soon. That is Dr. Bruce AYLWARD, who led the WHO China Joint Mission on COVID-19. Another piece of the exclusive interview with him tomorrow at the same time on our program. And you're watching now World Insight, still to come on our live program. Trouble over COVID-19 testing and outbreak response in the U.S. A former U.S. CDC chief and another public health expert shed some light right after this break. Welcome back. You're still watching World Insight, the live program. I'm Tian Wei. Moving on to the U.S. response to the COVID-19 outbreak amid the Super Tuesday Democratic nomination. It's unusual for the U.S. to go into election with a brewing global health crisis. The past week, epidemic jitters sent U.S. markets tumbling. The U.S. President Donald Trump's outbreak response has fueled attacks from Democrats after the U.S. president played down risks of widespread infection. It could also be a test on the U.S. healthcare system, the only one among industrial nations that is not universal. Health officials have raised the questions on the system's ability to respond to an outbreak. But certainly, we all hope things will calm down in any part of the world, including in the U.S. But now, how well is the U.S. dealing with the COVID-19 outbreak this time? Let's get some answers from some real people in the know. In New York City, we have Dr. Thomas Frieden, a former director of the U.S. CDC, the Center for Disease Control and Prevention, under the Obama administration. He's currently president of the Resolve to Save Lives, a 5-year initiative to prevent epidemics and cardiovascular disease. I guess we're inviting the right person in this regard. In New Haven, we invited CHEN, an associate professor of health policy and economics at Yale School of Public Health. Welcome as well. Let me start by asking you, Dr. Frieden, with some of your earlier experiences, what do you make of the latest decision by the U.S. CDC not to release any numbers anymore to the public about the so-called suspected cases or cases under investigation?
Generally, in the U.S., the approach we take is to tell people what we know when we know it. Often there are limited amounts of information, and the key is to be frank with that. What you've seen is an extraordinary response globally. And globally, we're really amazed by what China has been able to do with very extensive community action to control cases, particularly outside of Wuhan. In the U.S., CDC has a key philosophy, which is to be first, be right, and be credible. And that's why you saw Dr. Nancy Messonnier, who's leading the response at CDC, level with the American people some time back. She said, there are going to be more cases. Get ready. It may spread in the community. That's the kind of free and open communication that makes the CDC one of the most respected institutions in the United States. And it's why people believe CDC when CDC says things.
Okay.
Currently, you're seeing a lot of confusion. There was a problem with the test kits, and a lot has to be done to make up for that.
We hope the CDC also in the U.S. this time will function as it used to be, as a good model. However, Dr. Frieden, there are questions, as you said, about the test, particularly about whether the CDC policies toward who to test and who will have the access to test, and whether it is as much as $3,000 or even $4,500 in some localities in the U.S. to have one test like that. Who should have access to it? Whether only rich people could have access to it. Dr. Frieden, as someone who served in public office, what do you make of all of these controversies?
So there was a problem getting this test kit out. I don't know any details. I'm not in touch with people there now. In the responses that I oversaw for H1N1 influenza and the Zika virus, the CDC laboratories produced hundreds of thousands of test kits very rapidly, distributed them not only to every state in the United States, but to more than 100 countries around the world, and we didn't have a problem with them. So something has gone wrong with this test kit. We'll need to look and see what went wrong to prevent future problems. Right now, they're scrambling to make the tests more widely available, and we hope that in the coming days and weeks that will get resolved. The test should be free to patients. In fact, all public health services should be free to patients.
But Dr. Frieden, you know better probably than anybody else that this epidemic, as earlier being illustrated by Dr. AYLWARD from WHO, is fast, really fast. So if we talk about days and weeks, it's going to be a lot of dangers. As we have seen also inside China, we experienced that firsthand. Everything has to be really fast. Dr. Frieden, I'm sure you know that.
Yes, absolutely. What the U.S. has done is to allow hospitals to use their own tests and to allow commercial companies to make tests as well. And that's why some of the questions on cost have come up. The test shouldn't cost very much. It's a relatively straightforward test. But the patient shouldn't have to pay. There should never be a reason why someone would not seek care because of cost.
On the other hand, we have seen a team led, or shall we say, general by the Vice President. Of course, there are certain track record by the Vice President about public health issues that may not necessarily very supportive about his current role. However, we do wish the best of the team. However, Dr. Frieden, there's the issue of transparency, there's the issue of getting people prepared, there's the issue of all the societies should be supportive to the CDC and to the all the measures taken in order to prevent the spread of the virus. However, states are having their own authorities in the United States. I understand inside the United States, there are also a lot of public events that are going on despite of the danger of COVID-19. Now, Dr. Frieden, how would you resolve this, federal, local issue? Meanwhile, real experts were not that are in charge?
First off, today in the United States, COVID-19 is not spreading widely. There are some communities where it's spreading. It may spread widely in the coming days and weeks, but it's not. So we're not canceling mass gatherings yet in the U.S. In the U.S., there's a different approach. Each state has
Dr. Frieden, if I could ask your expert opinion.
There's a federal level, but the states also have autonomy.
If I could just jump in and ask a very specific technical question. To what would you say when it is becoming serious, quote unquote?
The approach to COVID-19 has to be to try to contain it, to end it as much as possible. If that becomes impossible, if you can't trace every contact, then you try to mitigate it or reduce the harm. And China has done a superb job of looking at different areas, just as Dr. AYLWARD was just saying, and taking a tailored approach to different areas. Right now in the U.S., we're trying to stay in the containment phase. In one part of the U.S., Seattle, There are lots of cases. A nursing home is hard hit with multiple deaths in that nursing home, and we're very concerned about places like nursing homes where older and sick people are living together and where the virus can have a really devastating impact.
Dr. Frieden, also we see, unfortunately, some of the stigmatization and also racial discrimination, putting tags onto, one ethnic group or another, one country or another. Here in China, we are trying to say we are against that, no matter which country that tag has been tried to put on. So, Dr. Frieden, what about the situation inside the United States? How do you, as a public health official who served many years for the White House about that issue, be able to speak up and also provide your advice, sir?
Let me make 2 points, please. First, we reject any form of stigma. It's harmful and it's also irrational. In fact, just this morning I advised WHO on an informal advisory group, and the point was made that people coming from China outside of Wuhan actually may be safer than people coming from anywhere else in the world right now because it's so well controlled in terms of COVID itself. But fundamentally, second point, we are all in this together. Whatever country we're in, whatever race or ethnicity we are, we have a common enemy. That common enemy is a dangerous microbe. And by collaborating, by working together, we can make a really big difference, improving our own health and the health of our neighbors, our communities, and our countries.
Public health officials know this very well, and I also want to invite in now Mr. Xi Cheng to join this conversation about that cooperation. How much are we seeing it played out there in the world today? It seems that everybody is fighting their own fire. What about fighting this fire together? How much have we done?
Yeah, so far I think the global community is still lacking the joint efforts. So every country is facing their own problem, but gradually every country is coming to the common point where the community transmission is ongoing, like in the US. So I think there's really need a global coordination in terms of sharing of the information about still passengers, because not all the flights are banned and not all the travels are banned. And also join hands to fund the development of antiviral drugs and vaccines. And I think domestically, the U.S. Need to do more besides what Dr. Frieden have been saying. I think at the individual level, we need to do more. For example, social distancing might be a good strategy now. We may need to cancel unnecessary social gatherings and events. And also, I think what's very important is to protect those vulnerable people. So yesterday, my colleagues and I at Yale were joined by 500 public health researchers throughout the country. We issued an open letter to Vice President Pence and the U.S. government officials to try to pay enough attention to the vulnerable. For example, their health insurance coverage is less enough. Many people, like 10% of them, are under no coverage of health insurance, and their labor market arrangement is not flexible, and they cannot get paid if they have sick and they stay at home.
Yeah, Dr. Frieden, I also want to
kind of issues.
Okay, thank you, sir. And Dr. Frieden, if I could also ask you the same question. We understand there is something different compared to SARS. At that time, there was not that much geopolitics going on, but now we have seen a cold reality of that. Dr. Frieden, therefore, people have a doubtful layer whether real cooperation could happen on as important an issue as public health. Dr. Frieden.
Public health can transcend politics. At the height of the Cold War between the United States and the Soviet Union, those two countries collaborated to help rid the world of smallpox forever. In the war in Afghanistan, the Taliban and other parties agreed to vaccinate children against polio. We can collaborate here, and the way to do that is through global health security. This is a program launched 6 years ago that identifies areas in Asia and Africa that really are gaps in preparedness. A major investment is needed, both to help these countries respond to COVID and to prevent the next epidemic or pandemic. It will cost some money, but it will save a lot of money and lives. We can work together to make the world safer. And I think we hope that the U.S. government will renew its commitment there, that the European Union, that China, that development banks will get together and say, there are too many global health security gaps. Let's work together. It's in all of our interests. We're all connected by the air we breathe, the water we drink, the food we eat. Let's work together to make the world safer from microbes.
We need to have that voice very loud there. We need to really work together on something that should save lives. And another thing about this, what we're discussing is a U.S. case. It's Super Tuesday. I mean, you have so many political gatherings. This is an election year. To what degree do you think a public health sector have to deal with this extra layer of reality, Mr. CHEN?
I think the cancellation of unnecessary events and social gatherings, as I mentioned, would be very important. And but for doing that, we really need to have people, everyone who are suspected to be affected, to be tested. With that, everyone have a better information about their risk and the risk at the community. Then they can take necessary steps. I think the bottleneck currently is not the number of test kits, because those test kits are more becoming available to the test centers. And according to this, the reports, like 1.5 million test kits, tests can be done in America this week, by the end of this week. But what's the bottleneck is the test centers. Because there's a capacity for each test centers to do this. So if we do not have enough test centers to do this, then the test kit may not be functioning as much as they could.
Dr. Frieden, do you agree with that? And also about the availability of tests, the quality of the test kits, and also the quality of the experts, shall we say, or people working in the test centers?
The CDC was very open when there was a problem, and they reported that openly. The healthcare system in the U.S., as in many countries, is weak in primary care. Most countries in the world don't have good primary care. That means people come into the emergency department when they don't need to, and that crowds the emergency departments, makes it difficult to deal with the real emergencies. This is a problem in many parts of the world, many countries. But I think we have some infrastructure that's helpful. Sentinel surveillance for influenza. This is also present in China and many other countries. There you can track where the infection is in the community. Infections that are severe in intensive care units. I think we'll be seeing in the coming days much more information about this. What we've seen so far from multiple countries that have done lots of testing is that in many places there aren't cases yet. The key is to track going forward. Even in China, as economic activity resumes, we don't know what will happen with future cases. That's why we have to work together and keep our guard up.
Yeah. Dr. Frieden, you worked for the issue of Zika virus. Mr. Chen, I know you also is an expert in many of the public health issues. So let me ask you also about the research area, which I also posed a question to earlier, Dr. AYLWARD of WHO. We have seen some latest research today, as of today, from the Chinese researchers. We noticed that 193 mutations have happened to the original virus when the spread of COVID-19 started. So what does that mean to all of us in terms of prevention and control of COVID-19? Is it going to be much more and much intense work ahead? Dr. Frieden, you go first, and then go to Mr. Chen.
Only time will tell. So far, although the number sounds high, the proportion of the whole genetic material of the virus has not changed much. And because it is spreading so widely, the evolutionary pressure on it to change may be relatively less. But we did see, you mentioned Zika, there's just some recent reports that Zika may have behaved differently in Brazil than elsewhere because of genetic changes. Those haven't been confirmed, but it's the example of another reason we need to collaborate, so that anywhere this virus is spreading in the world, there can be tests done of its genome and we can track them. But one thing to be clear, it's not enough to know what the genetic code is. We have to also know the epidemiology, how that relates to the pattern of spread and the pattern of illness. It's a puzzle that has to be put together. It's not some magic answer that's in the genes.
A lot need to be done in the pipeline. Mr. Chen, you want to go ahead also with the same question about research. What are some of the most important points we have to really get it done?
Yeah, we still need more data to judge how much mutations have been going on. But this poses a challenge to the vaccine development because the virus is keeping changing. So we need to put our best efforts to the joint hands of development and the research on the vaccine development. And this is very important because we already know this vaccine R&D is already very crowded industry. Many people are stepping in, but we need a more innovative way to join hands. For example, there's a recent model of CEPI and others trying to have collective efforts from the government and NGOs and trust funds.
Right.
So that may put our efforts into the best, more efficient use to combat this virus outbreak.
Certainly, we have heard about the CEPI approach, and we talked also to the chairman of the CEPI organization. Go ahead, Dr. Frieden.
Yes, if I can just make another point about research, treatment is crucially important. We're likely, if there is a treatment that works, we're likely to know that far before we have a vaccine, and that can be very helpful.
Yeah.
So doing rigorous, scientific, randomized, controlled trials will be important, and reporting that information immediately.
Yeah.
Sometimes in public health, we report things to the public through the media, through an official announcement before even it comes out in scientific publications, and that can be a very important and responsible thing to do.
Time is so limited, gentlemen. I really want to ask you one final question. I hope our conversation could continue. Dr. Frieden and Mr. Chen, what do you make of the next few important steps to do in order to prevent and control COVID-19 from spreading further, particularly in the United States? Dr. Frieden, you go first.
We're going to have to work at 3 levels. At the individual level, stop shaking hands, cover your cough, stay home if you're sick. At the healthcare level, surge safer. Protect healthcare workers so they don't get infected, and get ready for lots of patients, many of whom won't be very sick at all and some of whom may be very sick. And third, at the government level, fund efforts, collaborate across society, share information promptly and openly, and adapt. As we learn more, we will change our approach. Every day we learn more about this virus. Every day we're able to protect people better from it. But some of the spread is going to be very difficult to control, so we'll have to limit the harms it causes to society and collaborate with countries all around the world so we learn more and do more to make us all safer and healthier.
Limit harm inside the country, cooperate with all the other players possible. Mr. Chen, what's your take? Final words before we go.
So it's very important. I think most important to have everyone to have early diagnosis and understanding their risk. And at the patient level, provider level, and the payer level, we all need to take more efforts. And more importantly, join hands with the global community. And we cannot put every bet on the vaccine. We need to have multiple solutions in order to solve this crisis, like the antiviral drugs.
All right. Well, time is so limited when we talk to real experts. Thank you so much, the two of you, helping us to understand much more insights about COVID-19. CHEN and Thomas Frieden, really appreciate it. All the best and be healthy. And that is all the time we have for today. If you'd like to see more, try to find us World Inside CGTN into your search engine, or check out our YouTube channel. Follow us on Twitter and Facebook accounts. From me, Tian Wei, and everyone on our team, thanks for watching. Bye for now.